Hospitals operate around the clock, relying on lighting that supports patient care, clinical accuracy, and safety. But designing healthcare lighting is complex, demanding a careful balance of performance, comfort, compliance, and efficiency. Lighting must help clinicians see clearly while avoiding glare or visual fatigue for patients. Too much brightness causes discomfort, but too little risks clinical accuracy. Trojan Lighting addresses this by designing schemes in line with CIBSE LG2 and NHS Technical Memorandum guidance. Using low-glare fittings and controlled illumination, Trojan Lighting adapts lighting to each space, ensuring every area from operating theatres to recovery bays supports both precision and well-being. Hospitals must meet strict safety and emergency lighting standards, such as British Standard 5266. Manual testing is time-consuming and disruptive. Trojan Lighting integrates self-test and wireless emergency lighting systems that automatically log test results and report status to estates teams in real time, keeping facilities compliant and freeing staff from manual checks. With rising energy costs and sustainability targets, hospitals need to reduce consumption. Trojan Lighting's LED retrofit and remanufacture programs cut energy use by up to 75%, while long-life components and lithium iron phosphate emergency batteries lower costs and reduce carbon footprints. Every hospital is unique. Trojan Lighting's intelligent lighting controls, including MyMesh, DALI 2, and Kasambi, enable wireless monitoring, dimming, and zoning across entire estates without rewiring, adapting to occupancy and daylight. From patient rooms to plant rooms, Trojan Lighting helps hospitals overcome their toughest lighting challenges safely, efficiently, and sustainably.